the brain. And my favorite parts about the brain are those that are involved with learning and memory and language and all the things that make us human. And so I ended up choosing a fellowship in behavioral neurology, cognitive and behavioral neurology up at the Mayo Clinic. And I really feel blessed in my training that I got to see a lot of the rare types of diseases that cause dementia, as well as the common types with Alzheimer's disease mostly. And then I also participated helping out at the study of normal aging at the Alzheimer's Disease Research Center up in Rochester, Minnesota. And then I got my first job at the back in Columbus, Ohio, where I'd done my residency and started a memory clinic there. And they said, tell us what you need to build a clinic just like Mayo. And that was a lot of things on my list. But by the end of 3 years, I had just a part-time social worker who was wonderful. But we couldn't do it all. And so when I had the chance to move back to my hometown, where my niece was just 2 years old, it was a no-brainer, no pun intended, to come back to Rochester and join the Memory Center here at Unity. So I'll talk more about my team as we go on, but I was asked to speak to you all about how best to get the most out of your visits with your neurologist or your care partner's neurologist. And I tried to keep the talk pretty general so that it could apply to anyone seeing a neurologist. But of course, my background is in dementia care. And so I think my slides are a little bit skewed to that subspecialty. But we'll go from here. So my hopes for today are to tell you a little bit about access to seeing a neurologist, the process to get a referral, and why is it so hard to get to see one, and then expectations in getting an appointment or what to expect at the appointment, and then how best to prepare for an appointment with a neurologist, and then kind of walk through what the experience at the office is like, and then talk a little bit about what future follow-up visits might be like. So access is a national issue. There just aren't enough neurologists. In general, there's a physician shortage. And this is, the perfect storm, all the things making it so hard to get in. There's a physician shortage in general. So when the primary care physicians are so pressured with time, 10 minutes on average to see a patient, they can only cover so much. And so they will frequently do referrals out to all the specialties. And it's hard for them to be the quarterback like they are meant to be. But then on top of that, there's a severe neurologist shortage. By 2030, there'll be a 19% deficit in the number of neurologists to meet the demand of people with neurological diseases. And we'll get into a little bit about why is there that gap. And this all was predicted back in 2012. The neurologists went to the Capitol bargaining to get more resources to train more people to go into neurology, but it's just been an uphill battle. The fact of the matter is the world is aging and living longer. And with that fact, there's just more neurological disease. Most neurodegenerative diseases are diseases of the aging. And we have better technology, better treatments, more innovations to help people survive longer. So there's a lot more than just diagnosing and waiting for the disease to run its course. We're helping people live with their disease. And so that's what leads up to long wait times. And then also the short appointment times that we're all pressured with. I think I said a primary care is given about 10 to 15 minutes for a follow-up. A neurologist generally gets 30 minutes allotted for a follow-up visit and an hour for a new patient visit. And that varies from office to office. But again, by 2030, 21% of the US will be over 65. And by, I think one statistic I read was by 2060, 1 in 4 US adults will be over 65. And the main risk factor for any neurodegenerative disease is age. That's a bigger risk factor than family history or diet or genetics. It's just getting older. And with all the aging population, that includes a lot of neurologists, especially in the baby boom generation. And those neurologists are retiring, adding to the deficit of future neurologists. And then, why can't we get more people to go into neurology? There's a misperception that neurology is too complicated. I've heard it called neurophobia. And then, sometimes people have asked me, why do you go into a field where you can't do anything for patients? You can't cure ALS or dementia, so why would you spend your life doing that? But I think there's a lot we can do to help people with those diagnoses. So trying to broaden their horizons is important. If you were to look at studies of how all the different subspecialties get compensated, neurology is historically in the bottom third. So if people go into it for the money, they don't choose neurology. And if you look at studies that are measuring the burnout in physicians, neurologists surveys will report depression and or burnout in more than half. So it's just a difficult situation, and all of us, I think, feel guilty that we can't get more patients in, but it's simply a math problem. So we'll just talk about the perfect situation when you can get a referral and can get an appointment, and just expect that there is going to be several months of waiting. So this is the latest data from the American Academy of Neurology, surveying thousands of neurologists in the US about their different clinics and what their average wait times are. And so for a new patient appointment, it's average from the time the referral is made by the primary care doctor to the actual appointment can be 30 to 60 days on average. But for some people, the more narrow the subspecialty, it can be 6 months. And that's how it was for me in Ohio, which was just unacceptable for me. And then for a follow-up appointment, it's frustrating to me to not be able to get people back in to tell them their results quick enough. But the timeline for a follow-up is not that far off, 30 to 90 days. So I'm definitely a believer in I call them my right hand and my left hand with my physician assistants to try and help improve access to our clinics. So again, the subspecialists, this is a lot of projection of dementia patients and how the tracking of different referrals would look going forward. And the number of specialist visits, if we can't get anyone else to go into our field, this is the dotted line that never really goes up, unfortunately, isn't going down. But this graph here is looking at the number of referrals to a memory clinic just based on a cutoff score on a memory test. So if a person went to their Medicare physical and didn't do so well on their mini mental exam or MOCA test, and they just were reflexively referred to neurology, there's still way more referrals than available appointments. And the same thing, if we had a blood test that could, predict who should be seeing a specialist, it would be the same trend that they predict: more referrals than available visits. But they're trying to see if you could do both, we could definitely decrease those wait times from, I think they said 50 months to under a year. So with more people aging and fewer neurologists, we have to think outside the box here. But trying to talk about what I know, which is the Memory Center at Unity. I did a search in our medical record just within Rochester Regional, so not even including patients from the U of R system. We have over 31,000 patients in the database that have at least one of these diagnoses in their chart. And of all those patients, presumably being followed by their primary care doctors, we are managing almost 4,000 of them. That's just a tiny percentage. And we're a rare facility because there's two of us, cognitive neurologists, and that's me and Dr. Gill. And we are the only board certified cognitive neurologists in Western New York. So this is an extra level of certification that we've done, and we keep doing an annual exam every year to keep this certification. So that is why we do depend on our, like I said, my right hand and left hand, Matthew and Allie, to try and help see more patients. So expectations of when you do get an appointment, and a lot of families tell me, I know my parent needs to see a neurologist. I know there's dementia. Our mom had dementia, but they will not come and see the doctor. Or, my husband needs to see you, but I can't get him to come. How do we get him to come? So I wanted to talk about some of the myths and fears out there that seem to be repeating themes of why people don't want to come to the memory center. Okay, I try to tell people I'll tell them bad jokes at the beginning to keep them from getting nervous. But it's normal to be nervous in any situation that's new, especially a new doctor's office. And I try to tell everyone here, at least, and spread the word that you will not be locked up at the memory clinic. I've never sent anyone directly to a nursing home from the office, but this is what patients have told me their worst fear is, that their family's trying to put them in a nursing home, and by going to see me, that's the next step. So that's why they don't want to come. People are claustrophobic and they don't want to ever get an MRI, and they without time to think about it. And I tell them we're not getting an MRI today. Insurance just simply has to approve it first and give more time to think about it. And I've never diagnosed anyone as crazy. I try not to throw the psychiatrist under the bus, but I tell people that we are neurologists here. If there's something going on, it's a disease of the brain, and that no one is crazy here. Okay, so as far as strategies to get talk yourself into coming to see me, or getting a loved one to come see me. You can reassure them against all these things I've never done. Also tell them that whatever you need to tell them, but make sure you tell the neurologist so that we can all be on the same party line. Oftentimes not telling your loved one that about the visit until the day of can help eliminate some of that anxiety of getting dressed, at 4 a.m. for a 2 p.m. appointment, or just constantly asking, when's the appointment, when's the appointment? If they absolutely refuse, they're not going to come, you can make the appointment for yourself in name only. And while you're there, we'll just make the appointment about him or her. There's all sorts of value in therapeutic fibbing just to come, and I'm very good at putting people at ease, or I like to think so. Okay. And as far as hospital visits, I have sent people to the emergency room, but it's very rare, and I've had good reason. They've either fallen right in front of me, they stand up and their blood pressure drops, and I need them to go to the ER to get some fluids. One time, I actually had to call 911 because someone rolled and their walker and tripped and fell backwards and hit their head out by the elevators. If I see someone having a seizure or a stroke right in front of me, I'm going to make sure that they get the help they need. But I never send someone directly to a nursing home. Okay. A lot of people say, I want my family to come back with me. Others say, I don't want my family to come in with me. And again, that's up to you. Whatever you're most comfortable with. At the Memory Center, we try to have someone come with you, at least for part of the visit. I call them corroborative historians, just to make sure that you don't forget to tell us something that you might forget. But if there's ever anything that you want to just talk with me or your doctor privately, you just have to let the nurse know, and she or he will make sure that you have the time to have that doctor-patient relationship. Sometimes, you live here in Rochester, but your kids that are concerned about you are out of state. Thanks to COVID, we found other ways to connect people, but getting a speakerphone call in the room can also help with that history gathering. But we try to make everything as stress-free as possible. Are there any questions about other situations I didn't anticipate? I don't see anything in the chat, so I'll keep going. So in preparation for a visit with your neurologist or your care partner's neurologist, I have some tips for you. When you actually make the appointment, ask right up front, is there any paperwork that you need to complete? My office staff is very good about mailing out new patient packets, but they get lost or people forget them at home. But just trying to do as much ahead of time so that you can think about it without any pressure, trying to rush and do that in the waiting room. Trying to remember your family history can be hard if you're not at home and can't call people. And once you're established with a clinic, if you want to give an update or before the next visit, they here at Rochester Regional, we use MyCare, and at U of R, I know the medical record uses MyChart, and you can send questions ahead of time before you forget them, or you can just say you want to bring this up, but you don't want your kids to know, or your kids can even send a message and say, we don't want to seem critical, but we want to make sure you talk about this with our mom or dad. All right, always make sure you've got the most up-to-date insurance information. I don't want anyone to get any shocking bills or anything that is avoidable. And then also, if you're coming to a neurologist after you've seen one in the past, we're very energy conscious here and the lights keep going off. Just if you've had a brain scan or notes from another neurologist previously, the more information we can have to do the consult, the better. But oftentimes, hoping that a brain scan gets here ahead of your visit is just that, wishing and hoping. So the safest thing is to get the CD-ROM from the radiology facility with the images right on it, and then we can look at it together. Okay. So once you're at the office, make sure you bring that paperwork. If you forget it, as most of my patients have a tendency to do, it's okay. We have other blank copies to work on here, or we can just go through the questions verbally. Just don't want anyone to feel pressure. A lot of times we have patients that are late simply because they get lost, and I often recommend people do a dry run practice drive ahead of time so they know exactly where to go, and always confirming the date and time of the appointment. I've had people come a week early. I've had people come a day late, hours late, and it's just like I explained, we have such long wait times. It's really hard to reschedule without another long wait. But if you do that practice drive and you're here, you could just drop off the new patient paperwork and guarantee you don't forget it. And if there's any, different offices have different protocols, but for our follow-up visits here, an annual tradition is to have the caregivers fill out a bunch of forms about updates and caregiver stress and any depression and quality of life questions. So just making sure you're gathering all those updates as well. But, it's just like what my teachers would say before standardized testing. You have to get a good night's sleep and a good breakfast, but really just coming and being able to speak up and ask your questions. And one last thing, it's usually written, several different times in our outgoing paperwork, but bring all your medications with you. There's so many individuals that come and say, it's in the computer, and it's not always, and it's often not up to date. And a lot of providers here don't use the same medical record. The VA records we can't see. So just to make sure everyone's on the same page, if you actually have the medicine bottles with you or a good list of everything you're taking, that can just make for the better visit, because a doctor can't make the right recommendations if she doesn't know exactly what you're taking. We can talk about any other tips if you have them, other questions. We can save it all for the end, that's fine. Okay, experience. Again, just making sure you start out on the right foot with the office and getting there on time. Is doing that practice run helps. But we know life happens, accidents, 390, flat tires, getting stuck in your driveway with Rochester winters. And we certainly don't want to turn anyone away when they've waited so long for an appointment, but everyone else on the schedule has also been waiting a long time. And with a new patient, especially memory clinic appointment, you want the whole appointment. You don't want to get shortchanged. So really, to make the most of your appointment with your neurologist, you want to use the whole time. And one thing that steals time from the appointments is as soon as the nurse calls you, that's when you have to go to the bathroom. So just trying to take care of that ahead of time. But life happens, emergencies happen, and that's why we want you to forgive the neurologist too, if she's not running exactly on time. There's a lot of behind the scenes work that we're doing that we do on everyone's behalf, but that can slow us down. Oftentimes, I don't turn people away, and that makes me run late the rest of the day. A lot of times I'm on the phone just arguing with insurance companies, trying to get the medications ordered that I believe need to be ordered, and appealing the tests that have been denied. Sometimes, rarely, but sending someone to the ER or taking a call from the ER about one of my patients that showed up there from home, handling calls from nursing homes, taking calls from other doctors. We may not be in the room, but we're always taking care of you. So, and sometimes to take care of the caregivers, we're filling out paperwork. So we're respectful of you if it goes both ways. So assuming everything's perfect, you got your referral, you got in to the appointment, you filled out all your paperwork, you're sitting there with the doctor, what to expect at the visit. So, it should just be like any other doctor's visit you've ever been to. We're not magic. There's a lot of stereotypical neurologists out there, typically old men with bow ties and glasses down to here, but that's really not who we are. But it's really any other doctor's visit, just a conversation to get history. Don't make more of it than it is. The nurse will have weighed you on the way to the room, gotten your blood pressure and pulse, just like usual. They'll check your medications that you brought with you and make sure that any history, family history, all this stuff in the paperwork is up to date. And then that gives us a chance to review things, and I will still join you and have lots of questions to verify things. And so how do you know what's going to be on the test? No, there's no test. How will you know what the neurologist is going to want to know? And when we send out the new patient packet, it's not just an exercise in paperwork, it's trying to jog your memory so that you remember what's important that you want to tell us. Trying to help people remember to keep a little journal or list of symptoms in between visits so that we can follow up on those. And just, it's always a good idea, even before the new visit or follow-up visits, just to write down any questions you have, and then try to, number the top 3 that you'd be very disappointed if you didn't get to discuss them. Because there's never enough time to go over everything, but we want to make sure that we make an action plan for the biggest problems. Depending on what neurological disease you're coming to be seen for, I know my slides seem to be all about memory disorders, but usually the society for that disease may have a checklist online that you can print out and just use as a cheat sheet for monitoring symptoms. There are all sorts of migraine headache diaries. The Lewy Body Disease Association has a page with comprehensive checklist of symptoms. And, one example I found was from actually the Canadian Parkinson's Foundation, but I just liked how it was all on one little index card size paper, but just an example of things that people might want to keep track of for their doctors, but how are they doing with medications? How is their diet? Have they moved? Are they living in a facility? Are they still on their own? Are they driving, exercising? Just all the, more information, the better. Then the neurologist can step back and see what patterns might mean something. So the things that we're looking for, things the neurologist wants to know. What are you hoping to learn from today's consultation? Why are you here? How can we help you? If it's a follow-up visit, what's happened since you were here last time? If it's not in our system, we don't always get notified. So have there been any trips to the emergency room? Any surgeries, any hospitalizations? Sometimes they just want to know, did someone travel? So what's bothering you the most? Something new? A new symptom altogether? Are there things that you're not able to do anymore because of the disease? Are you falling more? Things like that. Going through the medications, even after the nurses checked it, I'm compulsive about checking it to make sure there's nothing on there that could affect memory, but just also asking, are you remembering to take your medications? And if not, are you avoiding taking them because of side effects? Just trying to figure out why people do what they do. Neurological diseases usually have a heavy toll on the mood, and so trying to address the whole person, not just the brain, but the mind as well. I said we're not psychiatrists, but we are boarded in neurology and psychiatry, so we're competent and capable and should be asking about mood. Epilepsy is a disorder with a high risk of suicide. Just trying to make sure that everyone's coping as best they can, because we know resources to help with that. And making sure that the care partners are getting enough support and trying to sense if they feel overwhelmed, and if they're covering it really well, being very stoic, not being so stoic that we don't know. Before I advance the slide, I see a little blip on the chat. Let me take a peek. So how do I share what's being, what you're observing behaviorally without interfering? And how do you share symptoms that might not be true? And, fabricating symptoms, and how do we sort all that out? We have ways. Sometimes writing the information out ahead of time, and slipping it to the nurse or slipping it to the front desk on check-in. My nurses are really good about getting that message back to me, and I have my ways of slipping things into conversation, and they never know who made that observation. I usually say, well, your primary care doctor is worried. That's why they sent you to me. And so let's talk about that. And a lot of people just forget what they forget. They forget, things that have happened. They're oftentimes in dementia, the frontal lobe just doesn't have the judgment that it used to. And They're trying their best to make sense of things that don't make sense. And we have to, if we can't ask right then, usually my trick is to have the care partner sitting just behind the patient. And I have a lot of exchanged glances, and I kind of watch for the head shaking no while the person's telling me that yes, they went fishing and riding their bike yesterday, when clearly they've been sitting in front of the TV for weeks. So we can sort that out in code a lot of times. Hopefully that was helpful. So getting back to other things we try to get at in our interviews, not just specifically what symptoms, but how often are they happening? How intense are they? Are you still going about your daily activities, or is it keeping you from working, or enjoying things with family? When it comes to dementia, we often are wondering, is the person taking care of hygiene, continence? So we try to feel that out. Sometimes the odor of urine is so strong coming in the room, and yet the person says, nope, everything's fine. And so there are some tough situations, and we try to make sure there's no bladder infections and things like that. I often, or always in my practice, to find out about how a patient's sleep is going, because the brain needs sleep. Sleep deprivation is a risk factor for seizures, definitely makes attention and memory a problem. Sleep apnea is a risk factor for stroke, for dementia, heart disease, and there are certain sleep disorders that can predict different dementias, such as Parkinson's and Lewy body disease. So anything that you might think, oh, she wouldn't want to know, that might be relevant. Also, a lot of people are losing weight because they forget to eat, especially if they live by themselves. And some people are gaining weight because they forget that they've eaten and they keep eating again. So appetite questions are important, as well as the after effects. Is there diarrhea? Is there constipation? Is there dizziness because they're not drinking enough water? So we've got a whole bunch of questions that we want to ask. But if these are things you've already been noticing and you come with them, just this is the talk about how to talk with your neurologist, you're prepared about these questions. And I always try to end the visit with any other questions that you may have. And we try, you don't want to go through the whole visit, and then when the doctor is wrapping up, say, oh, and by the way, we don't think he should be driving anymore. Yeah, that, there's never enough time to address that, even if you start with that. But I understand why people leave that, but I always take that very seriously. And that should definitely be one of the top 3 things on a person's list. But leaving something to the very end that's important to you always makes it rushed and won't get the time and expertise it deserves. And to come back and discuss it is a challenge. And so sometimes you might expect to come back and talk about that with one of the physician assistants or NPs, or try to get another appointment, because there's never enough time to cover everything. So along the vein of preparing for these visits, just trying to have the goal of keeping all your health information in one place. I have some patients, I swear they used to be engineers. They have spreadsheets and they keep all their information so organized, and it's great because I can just glance at it and see anything highlighted that's new since the last visit, and I just update the notes and keeping the list of medications there. And if they always have that on their person, if they, fell out at Wegmans and got taken immediately to the emergency room and before family could get there, the emergency room doctors would have all that information. So trying to gather all that information in some kind of journal or one sheet of paper would be great. So this is, just some of the information that people track for me. They keep track of their family history. Definitely the chronic illnesses like diabetes, and highlighting any allergies, because if you couldn't talk for yourself, you'd want some kind of representation of what's going on. And then these are just examples of, what I might put down as top 3 concerns for a loved one. And, just giving specific examples. I fall asleep okay, but I'm just not sleeping through the night. Or, embarrassed because I'm not making it to the bathroom in time every time. And just, having the insight to say, I'm feeling sad that I'm getting worse. And, and sometimes people won't put that down, and you have to, as a physician, I have to kind of feel that out. Sometimes we have screening questionnaires about depression and anxiety, but it's always best if you're having any of those feelings that you want to talk about with us, speak up. It's your time with us. So for future, after the visit, we usually have an after visit summary or AVS that prints out, or some people are environmentally conscious and say, oh, I'll just check it in my care. Well, make sure you check it in my care, because it often has very helpful information. I am always typing out a little summary of things we discussed because my patients don't remember. Making sure that you have a follow-up appointment if you need it. Is it written somewhere in case you forget your MyCare password and can't log in to see when it is? If you left it open-ended, or you're just, the copay for the neurologist is too high, I'm not coming back. Is there a plan for testing and following up with the PCP? A lot of times we're just consultants, and we give all the information back to the primary care, and they just wanted their questions answered. A lot of times I recommend people sign up for the MyCare or whatever patient portal access they need, because if you forget what we talked about, you can always refer back to my whole consult note when I finish it, which is even more detailed than the visit summary. And then again, do you have the summary? If you talked about any new prescriptions, did you pick that up? Do you have more questions about it? Any side effects from it? Just knowing where to call if you have those issues. And people always think of questions later, and just write it down so you don't forget again, and call the office when you get a chance. A lot of people or their caregivers take lots of notes during our visits. I'm blessed, that I am a neurologist and I get more than 10 or 15 minutes with my patients. But we talk about a lot in a short period of time, and it's not always conducive to taking notes if you have memory loss and you're focusing so hard on what we're talking about. But sometimes people look at their notes and have more research that they wanted to look up after the fact. And so making sure you're doing that. My take-home messages today, before I open up for more questions, is speak up and ask the questions if you don't understand something. This is your time. You're the patient. It's a doctor-patient relationship, not just the doctor. And if you don't understand something, you need to ask. And there's never enough time to cover everything. So the best way to talk to your neurologist and get your needs met is to prioritize the top 3 things. And if there's more than that, just plan to have another visit for those. And in order to take care of all the other issues, use the whole team. I can't speak highly enough about my physician assistants. That's, there's only one of me and only one of Dr. Gill. And you saw the statistics of the shortage of neurologists, and the advanced practice providers or nurse practitioners, physician assistants. This is how the future of medicine is going, and use them. They're supervised by us. They can get to us with any questions they can answer, but they're an extension of us. And then we are dependent on our colleagues at the Finger Lakes Caregiver Institute, and I'm grateful to them for giving me this opportunity to speak today. So much of the top 3 problems come back, and they're really social work issues that I don't know how to manage. So I depend on referrals to Lifespan. And on Tuesday, Wednesday, Thursday afternoons here in the Memory Center at Unity, we have staff. Jessica Polino from the Alzheimer's Association is here for additional questions and care. So knowing the resources that you have available at whichever clinic is also important, and that's usually on their website. But just remember, we're all in this together. So just some things about general brain health. You want to stay active physically, mentally, and socially. And my hobby, which lets me do all 3 of these things at once, is to ballroom dance. Especially if you're doing beanies, waltz, or quick step, there's a lot of physical activity. You're learning the choreography, so there's your mental activity, and you're dancing with a partner, so there's your social activity. So I've been dancing with Fred Astaire Dance Studios as a student since 2010. And, I take home all my patients and their families' stress, and for 40 minutes of a dance lesson, I don't think about it. So whatever you do that you enjoy, that you'll keep doing, that's good for your brain. So this is the rest of my team. We have 3 wonderful neuropsychologists and a psychometrist, Crystal, and they also run a healthy brain aging program a couple times a year, and they help, the whole team helps with our other education programs. So I will stay here for questions. And Cassidy has put a link in the chat for the survey for today.
Yes, if you could take a second to fill that survey out, that'd be much appreciated. Thank you.
I don't see any other questions. I did want to mention, this is Katie Ellen. I'm the division leader for caregiver services here at Lifespan. And I'm thinking all of you are connected with us in some way through either our Caregiver Institute or other programs at Lifespan. We really encourage you to continue to check out the Lifespan website for additional offerings. Starting September 20th, we do have a 4-week series starting called Walking on Eggshells. And it kind of dives into challenging behaviors and aggression that can come with, on occasion with dementia. That's again a 4-week series. You can join for 1, 2, 3, or all 4 sessions. And I believe that is up on our website. And then this fall, starting in November, we have our annual information and inspiration month. And so there'll be a wide variety of education sessions provided both in person and online across many different topics related to caregiving and older adults. So we really invite you to check out our website and connect with us whenever you need. Do you see any other
Okay.
questions? Nope, all you, Cassidy.
No, you're good. I was just gonna ask the same thing. If there are any other questions, last minute. Okay. And if, oh, go.
I have a question. I appreciate your comments there, Katie. If everyone here is more caregiver, I hope that my questions applied to you. If you're more of a patient with a neurological disease, I hope it was helpful too.
I think every
Okay.
time you join us, Dr. Bruns, it is helpful. I know that both the folks that attend your sessions always have great feedback, and I think our staff that's on the session as well would agree.
This is the first time I've done this talk, and I didn't want it to sound like this is the ideal neurologist version of a visit, but these are all the things that could make it go well. So any feedback is welcome. And I think I'm the first speaker on the 20th for that walking on eggshells. So I'll see everyone then.
Okay, well, if there are no other questions, again, just wanted to thank Dr. Bruns for coming and speaking today. And just as a reminder, in the chat, there is a stat survey, and in the follow-up email, you'll receive a recording and also the survey link again. So again, thank you, Dr. Bruns, and thank you everyone for attending today.